What if the thing you've been too embarrassed to talk about is actually your body desperately trying to warn you about something far more serious? What if the conversation you've been avoiding could be the one that saves your life? Stay with me for the next few minutes, because what I'm about to share might be the most important health information you've come across in years. And I mean that without a single gram of exaggeration. Here's what most men over 40 don't know. That change you've noticed in the bedroom, the one you've brushed off as stress or aging, or just one of those things, may have absolutely nothing to do with performance, and everything to do with the state of your blood vessels, your arteries, the very system that keeps your heart beating, your brain functioning, and your body alive. And before you click away, I know this isn't the conversation anyone signs up for, but I promise you, the men who understand what I'm about to explain are the men who prevent the heart attacks that never happen, the ones who go on to live long, healthy, fully functional lives, not because they were lucky, but because they paid attention to a signal that most men completely ignore. My name is Dr. Eva Danial. I'm a medical professional and health educator, and this channel is dedicated to giving you the kind of honest, evidence-based health information that could genuinely change the trajectory of your life. If that matters to you, subscribe and turn on notifications so you never miss a video. Now, let's get into this properly, because this deserves a real conversation. You can now walk into a pharmacy and buy Viagra over the counter. No appointment, no doctor, no conversation. Just walk in, hand over your money, and walk out with the pills 5 minutes later. And look, I understand the appeal. It removes the embarrassment. It removes the barrier. And for a lot of men, that accessibility feels like a relief. But here is what genuinely worries me about that system. And this is the question I want you to sit with for a moment. What if the reason you need Viagra is because your entire cardiovascular system is beginning to fail? What if you are quietly, efficiently treating one symptom of a much larger, much more dangerous disease, and by skipping the doctor, you're allowing the real damage to continue building underneath, completely unchecked for years? Because that is exactly what can happen. And it does happen, more often than most people realize. Viagra works by targeting the blood vessels in the penis, because that is where the immediate problem is. Those blood vessels are not functioning the way they should. But here is the critical piece of biology that the pharmacy counter-conversation never includes. A problem with the blood vessels in the penis does not exist in isolation. It is not a local issue. It is a system-wide issue. The vascular system is not a collection of separate, independent pipes. It is one vast, interconnected network. And if the smallest vessels in that network are struggling, the larger ones, the ones supplying your heart, your brain, your kidneys, are almost certainly in trouble too. They just haven't started causing obvious symptoms yet. Viagra addresses the symptom. It does not touch the disease. And a decade down the line, the man who managed his erectile dysfunction with a pharmacy pill without ever investigating the underlying cause could find himself in an emergency room with a heart attack or a stroke. An event that, if you traced it back carefully, had its very first warning signs in the blood vessels of his penis years earlier, while he was standing at a pharmacy counter buying a convenient fix. That is the part that should make you stop and think. That is the part that matters. So, let's talk about what's actually happening. Let's talk about the real cause that most men over 40 are never told about. When men notice changes in their erections, the instinctive explanation is usually stress, or getting older, maybe low testosterone, maybe something psychological happening under the surface. And yes, all of those things are real. All of them can play a meaningful role, and none of them should be dismissed. But in men over 40, the single most common underlying cause of erectile dysfunction is not psychological. It is not hormonal. It is vascular. It is about blood flow. It is about the health of your arteries. And once you understand the physiology, once you really understand what is happening inside your body during an erection, all of this starts to make immediate sense. An erection is, at its core, a vascular event. It is plumbing, precise, elegant, extraordinarily well-designed plumbing, but plumbing nonetheless. When you become aroused, your nervous system releases a signaling molecule called nitric oxide. Nitric oxide is remarkable. What it does is instruct your blood vessels to relax and dilate, to open up and allow blood to flow freely. In emergency medicine, we rely on this biology every single day. When someone arrives in the emergency department with angina, chest pain caused by the heart not receiving enough blood flow, one of the first treatments we reach for is something called GTN, glycerol trinitrate. It comes as a spray under the tongue or a dissolving tablet. What GTN does is release nitric oxide, which opens the arteries and dramatically improves blood flow. We also use it during heart attacks when vessels are in acute crisis and every second of blood flow matters. So when I talk about nitric oxide dilating blood vessels, this is not abstract textbook biology. This is the mechanism that emergency medicine teams use every single day to keep people alive. Now back to the erection itself. Nitric oxide is released. The blood vessels in the penis dilate. Blood rushes into the penile arteries and fills the spongy erectile tissue inside. Then something equally important happens. The veins, which are normally responsible for carrying blood back out of the penis and back toward the heart, compress and close off. The blood becomes trapped inside, and that sustained pressure is what maintains the erection. Every single step of this process depends on healthy blood vessels. It depends on healthy endothelium, the delicate cellular lining of your arteries. It depends on robust nitric oxide production. It depends on arteries that are flexible, responsive, and clear. Now, consider what happens when those conditions begin to deteriorate. What if your arteries are starting to stiffen from years of elevated blood pressure? What if the endothelial lining has been damaged by chronically high blood sugar or long-term smoking or sustained inflammation? What if your nitric oxide production is declining? What if there is early atherosclerosis, the gradual buildup of fatty plaques inside your artery walls, beginning to narrow the vessels and restrict flow? The answer is predictable, and it matters enormously. You would begin to struggle with erections, or you can get one but cannot sustain it the way you used to, or the quality declines gradually in a way that is easy to attribute to age and just as easy to ignore. Here is the piece of anatomy that makes all of this so clinically significant. The penile arteries are small, roughly 1 to 2 millimeters in diameter. Your coronary arteries, the vessels that supply blood to the heart muscle itself, are approximately 3 to 4 millimeters wide. When atherosclerosis or endothelial dysfunction begins to develop, it shows up in the smallest arteries first. Because physics is unforgiving, narrowing in a 1 millimeter vessel causes symptoms far earlier than the same degree of narrowing in a 4 millimeter vessel. Think about it this way. A half millimeter plaque developing inside a 1 millimeter artery is already causing a 50% reduction in that vessel's diameter. That same half millimeter plaque inside a 4 millimeter coronary artery, that is only a 12.5% narrowing. You will feel nothing. You will have no symptoms, no chest pain, no warning, no signal of any kind. But the disease is there, it is established, and it is progressive. Left unchecked, it will keep building, slowly, quietly, year after year, until it reaches the point where the larger arteries, the ones your survival genuinely depends on, begin to be affected too. This is why the research is so clear and so consistent. Erectile dysfunction can precede angina by 3 to 5 years. It can precede a heart attack or a stroke by 3 to 5 years. The body is sending a warning signal, an extraordinarily early warning signal, through the smallest vessels in the system. And that signal has a name. It is called erectile dysfunction. And the vast majority of men either ignore it or treat it symptomatically and move on, never knowing that the earliest warning sign of life-threatening cardiovascular disease just passed through their hands. By the time the coronary arteries or the carotid arteries begin causing symptoms, chest pain, breathlessness, neurological changes, you're no longer in the territory of early disease and prevention. You are in the territory of damage limitation. The goal has shifted from optimization to survival, and that shift did not have to happen. It very often didn't have to happen. The scientific evidence behind all of this is extensive and robust. Erectile dysfunction is strongly and consistently associated with hypertension, insulin resistance, type 2 diabetes, elevated LDL cholesterol, smoking, and obesity. Every major cardiovascular risk factor on the list. Studies have repeatedly demonstrated that men with erectile dysfunction have a significantly elevated risk of major cardiovascular events, including heart attacks and strokes, as well as increased all-cause mortality. And this holds true even after controlling for every other known risk factor. In emergency medicine, I have seen the end stage of cardiovascular disease more times than I can count. What drives me now is helping people understand this early enough to prevent it. Because the genuinely heartbreaking truth is that a very large proportion of those heart attacks did not have to happen. The warning was there years before. It simply wasn't recognized for what it was. Instead of catching it early, instead of treating the underlying vascular disease when lifestyle changes can genuinely reverse the damage, we have built a system where the most visible symptom gets a convenient, expensive, over-the-counter fix that generates enormous profit and does absolutely nothing to address the root cause. The arteries continue to stiffen, the plaques continue to build, and the disease continues its quiet, steady progression. So what do you do with all of this? What is the right response if you are a man over 40 who has noticed changes in your erections? The answer is not to feel embarrassed. The answer is not to go straight to the pharmacy. The answer is to treat this as a screening moment, an early warning that your body is handing you, and an opportunity to investigate what is actually happening before it becomes something far harder to manage. Go to your doctor. Get your blood pressure checked. Because hypertension is frequently silent, it causes profound endothelial damage over years, and a significant number of men carrying it have no idea. Ask for an HbA1c, which is a blood test that measures your average blood sugar levels over the preceding 3 months. You may be surprised by the result. Prediabetes and type 2 diabetes are extraordinarily common, vastly underdiagnosed, and powerfully damaging to vascular health. Get your full lipid profile checked, your LDL, your HDL, your triglycerides, to understand the state of your arterial environment. Check your waist circumference with a flexible tape measure around your midsection, because visceral fat, the fat stored around your internal organs, is one of the strongest independent drivers of insulin resistance and cardiovascular disease risk. Be honest with your doctor about your smoking history, your sleep, your stress levels, your diet, and how much you are actually moving. These are not peripheral lifestyle details. They are the primary determinants of your vascular health. And here is the genuinely hopeful part of this entire conversation, because I want you to leave with this clearly in your mind. The things that improve erectile function are the exact same things that improve cardiovascular health. There is not a separate list. They are identical. Exercise, particularly a combination of resistance training and aerobic conditioning, improves nitric oxide production, improves endothelial function, lowers blood pressure, and reduces arterial stiffness. Weight loss, specifically reducing visceral fat around your midsection, dramatically improves insulin sensitivity and vascular health. A Mediterranean-style diet, rich in oily fish, olive oil, vegetables, legumes, nuts, and seeds, has among the strongest evidence of any dietary intervention for cardiovascular benefit. And research shows it independently improves erectile function as well. Your erection is, in the most literal physiological sense, a barometer of your vascular health. If it is improving, there is an excellent chance your arteries are improving too. If it is declining, that is information. That is a signal. And signals are gifts if you recognize them in time to act. The biology here is genuinely hopeful in a way that many chronic disease conversations are not. We're not talking about damage that is already irreversible. We're talking about catching a process early, at a stage where real, meaningful lifestyle change can genuinely reverse the trajectory. That is a powerful position to be in. Most people who suffer serious cardiovascular events never had that opportunity clearly presented to them. You do right now. So if you have noticed changes, do not feel ashamed. Do not go straight to the pharmacy and hand over your money for a pill that treats one consequence of a disease while everything underneath it keeps getting worse. Go and speak to your doctor. Get the important things checked. Have the honest conversation. Explore the lifestyle changes that are available to you because they are powerful, they are evidence-based, and they work. The men who act on this early are the men who prevent the heart attack that never happens. No emergency room, no ambulance, no ICU, just an ordinary Tuesday and another ordinary Wednesday after that because they paid attention to something most men dismiss without a second thought. Sometimes the smallest signal is the one that changes everything. I'm Dr. Eva Danial. If this video gave you something important to think about, please share it with your partner, with a friend, with any man over 40 in your life who deserves to have this information. Leave a comment below and let me know if this changed the way you think about this topic. And subscribe if you haven't already, because next week we're going deep into the specific lifestyle changes, the exact exercises, the dietary shifts, the sleep interventions that have the strongest clinical evidence for reversing early vascular dysfunction and restoring both cardiovascular health and sexual function. That is a video worth waiting for.